I'm Mandi. I'm a qualified counsellor and psychotherapist. I've been qualified for over 15 years. I also work as an approved social worker specialising in mental health. I have a degree in social sciences and a diploma in social work, various post-qualifying certificates in mental health, cognitive behavioural therapy. I work with a very diverse range of issues, including stress, anxiety, panic attacks. I also work with people who suffer from bereavement, relationship issues. Because of my mental health background, I also specialise in working with people who suffer from more serious mental health issues, such as bipolar disorder, schizophrenia, and various other issues, bipolar affective disorder, post-traumatic stress disorder. I also work with couples who are having relationship issues, also couples who are already separating and divorcing, in terms of helping them with mediation issues. I have a great deal of experience of couples work, and it can be very helpful for people to come together to talk to me about their issues, at whatever stage they might be at. And this can also be a useful thing to talk about on the phone in terms of trying to help people to find a resolution or a way forward. I work using two distinct approaches. One is called psychodynamic psychotherapy. This is based on people's past and how it affects the present. People often find that events that they've experienced during the past affect their relationships, affect what's happening in their life at the moment, and they often come for therapy to try and work through these issues. This is more a long-term approach of working with people. However, sometimes people find in this modern society that they prefer to just have a few short sessions, and that in that way I use cognitive behavioural therapy, which is about working on the present and changing the way we think about things, and in turn changing the way we behave. I tend to combine these two approaches together because cognitive behavioural therapy is very effective in the short term, and it often can change people's lives in a very short period of time. However, used on its own, sometimes it's not that sustainable. So with using it with psychodynamic psychotherapy and looking at the root of the problem, people often find that they can affect great change in their life, which is long-lasting. I also use mindfulness techniques incorporated with the cognitive behavioural therapy. Mindfulness is something that stems from a Buddhist background, it's about a form of meditation, but it's become very useful in Western psychology, and it's not how people would stereotypically think about meditation in terms of sitting on the floor chanting. It's much more about an awareness of ourselves in the present, and it's very useful when people suffer from stress, anxiety or panic attacks, in terms of stopping them from worrying about the future or things that have happened in the past, but become very focused on the things that are positive in their lives in the present. If you were to call me through Grapevine, I would be able to help you with whatever issue may have brought you to contacting me. We can talk through the issue. I often use cognitive behavioural techniques in terms of trying to effect some positive change in the short term, and it might be perhaps setting you some homework to do, which people find very useful because then they feel very proactive and empowered in order to help themselves. I do what I do because I love working with people, and even though people may all come with the same issues, everybody is different. No two people are the same, no day is the same, and I enjoy that diversity in working with different people, different issues, and also learning from them, because every day for me is a learning experience, and most of my learning has come through my years of working with people and trying to help them. And obviously for me there is a great deal of satisfaction in the feeling that I can help somebody and help them to achieve a better quality of life. But the most important thing in that, I think, is that I can help them to do it for themselves, and that they can go out and use their own resources, but just take some tips from me along the way.